This is Average Joe PT, and on this episode, third installment, we're going to talk about neck pain, specifically giving you headaches caused from your facet joint. That's right, we're going to specifically look at this facet joint in your neck area that's causing your problems in the first place. So stay tuned. The facet joint is a very tricky joint in your neck area. It's really small, and when we come in and take a look specifically at this joint here on the side, it's on both sides of your neck along the entire length of the spine itself. And as we go down the spine, it gets larger. But up here in the neck that we're talking about, this joint has a lot of these little yellow things which are representative of the spinal nerves coming off that can easily get irritated and inflamed when this joint gets inflamed because it's right next to it. And when we blow it up and we actually see what we're talking about, the yellow thing being the actual spinal cord and off of those little things called the peripheral nerves, and that joint is right there on the side. And when you actually have that disc also there too, so either the disc can kind of blow out and get things inflamed, the joint which we're talking about right here, that facet joint, that can also get things inflamed. And next thing you know, you're getting headaches, pain down your arm, all caused specifically from this facet joint. And that looking down motion that we're always doing nowadays at our phones, computers, tablets, all those things really puts a lot of stress on that facet joint because it opens that joint up and it keeps it in that lengthened, stretched, static position for so long. You wonder why it starts to hurt, and you're like, oh man, that right on that side, and it seems to radiate down on your shoulder blade. Now I go ahead and leave a tag up there. I have another video specifically talking about your levator scapula muscle, which is in your shoulder blade area that comes up along that facet joint area that can get involved. A lot of times it's a combination of the facet joint and that muscle group working with one another to give you that pain. So we calm down that joint really three different ways. Number one, we want to reduce looking down, so we want to come in an upright position or maybe lie down, and you want to do that position at least 3 or 4 times a day for a good 15-20 minutes just to rest your neck in that joint. You want to ice it, get that inflammation to calm down 15 to 20 minutes, 3 or 4 times a day. And then number 3, you really want to take some ibuprofen, some sort of anti-inflammatory that's going to help reduce that joint pain. And you take the combination, that trifecta, those 3 things together, anti-inflammatories, resting the position, staying out of that position that's causing the problem in the first place, and some of those other techniques that I've shown you in this other video. Number 2, it goes over some manual massage that you can do to that neck. You do those techniques and that will really help drastically reduce that facet joint pain that's giving you a lot of pain in your neck and giving you headaches to begin with. So if you guys have any questions, I want you to leave a comment down below, positive or negative. Scully and I, we don't care. And if you would like to subscribe and hit the bell, we'd love to have you guys come in. We bring content once or twice a week. But until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.